So friends, meet Dr. C. संतोष कुमार.
नमस्ते.
डॉक्टर साहब, आप कैसे हो?
I am fine. Hopefully everybody is fine.
Thank you, doctor, and we are so glad to have you in our show. And I'm sure our audience would also love to learn a lot from you. We'll start with something very basic, doctor. आप हमें बताइए, and we'll have this conversation in Hindi and English because our audience is global.
Okay.
Okay, let's start with something very basic, doctor. What is the basic difference between heart attack and a cardiac arrest?
Usually people think that cardiac arrest is equal to heart attack, but it is completely different. So a heart attack is a simple problem of blood circulation to the heart. Usually heart will have small 3 circulating pipes to supply oxygen and glucose to the heart. If there is a circulation problem, it will result in a heart attack. Whenever one of the circulation pipe is, whether it is blocked with a cholesterol deposit or whether it is blocked because of a clot, both can result in a heart attack. There is a stoppage of circulation. Okay, but cardiac arrest it can occur in a heart attack patient also, but it is seen in only few patients of heart attack patients, may result in complete stoppage of the heart. It is a complication we routinely see in heart attack patients also. But other conditions also can cause cardiac arrest, where there is extreme low heart rate and complete stoppage of pumping of the heart. It can occur because of other heart muscle weakness, heart door problems also. Any heart problem can result in the long term to cardiac arrest. Okay, so but heart attack suddenly, sometimes if it is severe and it is not treated properly, it may result in a cardiac arrest.
Okay, my next question to you, Dr. Saab, is किसको cardiac arrest हो सकता है? Who can have a heart attack versus who can have a cardiac arrest?
Yeah. So heart attack, routinely we'll discuss about heart attack because it is commonly and preventable thing. So if we know which patient develops heart attack, we can pass on the preventive message to the public. Okay, so heart attack is commonly seen in some risk behaviors. We call them as risk factors. Those who are having elderly age, diabetes, hypertension. So all these people are at high risk of heart attacks. Okay. On the other side, those who smoke and those who have an unhealthy lifestyle, that includes, I think, lack of physical activity, and very unhealthy food habits. Okay, so and those who are having uncontrolled hypertension, diabetes, as we discussed earlier.
Yes.
And those who are having very high cholesterol levels in the blood. So all these persons are at high risk of heart attacks. Okay. So,
Doctor,
coming to cardiac arrest, it can occur commonly in a previous existing cardiac problems like congenital problems, the heart problems which can occur through birth. Throughout from the birth time only. They are called congenital heart diseases. Or some of the valve related problems. The doors within the heart chambers, between the heart chambers, are called valves.
Yes.
If there is a problem, it is called valvular problem. They can also result in cardiac arrest. And sometimes electrolyte imbalance also can cause cardiac arrest, because very low potassium, very high potassium also can result in cardiac arrest. This commonly occurs in kidney patients.
Oh, I see.
They can develop heart arrest, cardiac arrest, what we call, without any underlying, without a structurally normal heart, they can have cardiac arrest.
I see.
Okay, so all these can cause cardiac arrest.
Okay. डॉक्टर, ऑफ लेट हम लोगों ने ये देखा है कि इंडिया में देर इज सडनली अ सर्ज इन द काउंट ऑफ सडन कार्डियक डेथ ड्यू टू सडन कार्डियक अरेस्ट, स्पेसिफिकली इन इंडिया. What do you think is the primary cause for this?
Yeah, it is commonly noticed in younger population.
Yes.
Nowadays, the persons playing while doing some physical activity in the gym, or while playing some outdoor games, they are experiencing cardiac arrest and collapsing. So commonest reason for this is, I feel it is maybe sometimes whenever they develop massive cardiac stroke, they can develop cardiac arrest. The incidence is increased because of unhealthy lifestyle and diet habits and stress that is very common in nowadays in younger population. Okay, so all these are possible reasons for that.
So you're saying that these are the plausible explanations behind these rising cases of sudden cardiac.
Yes, particularly
arrests.
it is a lifestyle relation only.
Okay.
So,
But along with that, what we have also noticed is, Dr. Saab, कि पैंडेमिक के बाद, कोविड-19 के बाद सडनली इन केसेस में बढ़ोतरी देखने को मिली है. पहले परहैप्स दे एग्जिस्टेड,
yes.
बट इतना ज्यादा नहीं था. अब क्या रीजन हो सकता है कि पैंडेमिक, इज इट समवेयर रिलेटेड टू कोविड-19 डिजीज?
No, it is actually there was a increase in incidence during pandemic, and there was some doubtful relation to the COVID infection or COVID vaccine related heart strokes during that time.
Mm-hmm.
But whatever inflammation that can occur with COVID infection, usually it will be seen in few weeks after the infection only. Okay, so then vaccine related, what we expect is within 6 months, whenever the vaccine is effective. So in that initial period, the chances of blood thrombus formation was more at that time.
Correct.
Okay, but what we are seeing out nowadays, after almost COVID pandemic occurred in 2022, it decreased.
Yes.
So since then, the increase is mainly because of the stress that increased in the public and lack of awareness, health related awareness is not there. For this, I think health education about cardiac diseases is very much important. Okay, where people can identify the heart related issues very early in the initial stages.
Okay.
If we can identify and evaluate properly, they can avoid major stroke and risk of cardiac arrest.
Okay.
So early identification is crucial for this. For that, population education, health education related relating to heart diseases is very important.
Okay. Well said, Dr. Saab. My next question to you is, people these days are very conscious about their appearance and their physical aesthetics. अब इसके चक्कर में हमने देखा है young people, they get into things like surgical procedures, Botox, glutathione injections, and there are so many other things. Do these things, skin lightening and brightening procedures primarily, do these things cause any kind of abuse to the heart health?
Yeah, they will increase in whether it is beautification of face and aesthetics, all those things. They will cause some medicines usage. All this will cause inflammation in the body. Inflammation, if it increases, they can provoke cholesterol deposition in the heart circulation. So heart attack incidence will increase, particularly whenever there is inflammation in the body. So all these procedures and the stress related to all these factors like beautification, all those things, the people take more stress on those things. Okay, so the stress itself can result in increased incidence of heart diseases.
So as a doctor, Dr. Saab, do you think you would blame the buzz around social media, lifestyle and all of it for the craze on looking good and chiseled and spending hours in the gym to look fit? What do you think about it? To
be fit is a good thing, but to be fit by following a very crash course and aggressive surgeries, all those things, is not advisable. So there is a healthy way of reducing fat and increasing body muscle and being fit, being more active and reducing the mental stress. All these factors, if you club and follow, then it will result in a more benefit to any person. So what I understand from what you said, Dr. Saab, is it's not necessary that every fit body is healthy, but every healthy body can be fit. Yes. What you said is exactly correct. Okay. So because I did a survey so in runners in my locality, LB Nagar.
Oh, okay.
Regular morning runners they have an association called group called LB Nagar Runners. So I did a routine screening health study. In them past 3 years I am doing that every yearly once. What I noticed is majority of them are having almost up to 50% people are having high cholesterol level in the blood.
Okay.
So what I observe
Runners, and they are runners.
they are runners means at least 10 kilometers per 3 to 4 days a week. They are-
Oh, okay,
some of them are 20-30 kilometer runners, long runners.
okay,
Okay.
like marathons
So
and
they
all.
have very good physical stamina.
Hmm.
But only thing, the diet habits are not that good. Okay, they don't concentrate on what they are eating. So more lipid-rich foods they are consuming. Okay, so all this health screening is much important even in the healthy population also.
Absolutely.
Those who feel they are physically fit, they also need to watch what is their sugar level, what is their blood pressure level, what is their cholesterol. These are very much important to reduce future heart attack risk.
So would it be safe to say कि हमने ये recent time में जो celebrities में deaths देखे, TV actors dying due to sudden cardiac arrest, athletes dying due to sudden cardiac arrest, sports person dying to sudden cardiac arrest, these are fit people.
Yes.
They are the epitome of fitness. लेकिन इनके health issues थे जिसकी वजह से they actually succumb to cardiac arrest.
So what we know over the past few years, lot of celebrities having heart strokes. Some of them identified later on they were having a congenital problems. Like
Okay.
one entity is called hypertrophic cardiomyopathy. So where what happens, the heart muscle thickness will increase.
Okay.
Okay, they will have a good exercise capacity, everything, but during vigorous exercise the cardiac output and the heart muscle thickness itself obstructs the output from the heart, so circulation will come down. They may collapse during vigorous exercise. This is
Okay.
completely avoidable thing.
It's avoidable.
Yeah, because if you screen the heart it will be easily identified.
So how do you screen the heart?
It is a scan of the heart that is called two-dimensional echocardiogram,
Okay.
which is widely available, can be done easily. So everybody, I feel any person who joins gym at least at the age of 20, they should undergo a 2D echocardiogram once, because they are planning to do vigorous exercises, runnings in the gym. So at least this health condition, which is called hypertrophic cardiomyopathy, usually it will develop around 18 to 20 years of age, even though it is a genetic problem, but it won't be there in the younger age group, that
Okay.
is below 15-20. It is not identified. It will show its effect only after 20 years.
I
So
see.
any person who reach 20, at least once they should undergo 2D echocardiogram. If some person is having hypertrophic cardiomyopathy, his brothers, sisters should undergo, because
In the
it
family
strongly
also
runs in the
just-
family.
Okay.
Okay, another thing is cholesterol estimation. Okay, so recently we are seeing lot of familial hypercholesterolemia. That means they will have very high cholesterols. Their family members also will have that. Some people will have very high triglycerides. All these are at high risk of heart attacks in future. Okay,
I
if
see.
we can identify by simple screening blood test to know the cholesterol levels, we can use some medicines or lifestyle modifications that will reduce the risk of heart attacks.
Okay. Okay. That brings me to my next question, Dr. Saab. The next question is around, are there any kind of combination of signs or symptoms that our body gives? For our larger audience, I'll repeat this question in Hindi. क्या हमारा शरीर किसी तरह का सिम्टम और साइन देना शुरू कर देता है बिफोर एन एक्चुअल कार्डियक अरेस्ट टेक्स प्लेस? अगर ऐसा होता है तो ये कितने हफ्ते या फिर कितने दिनों पहले से होना चालू हो जाता है?
Yeah, heart attack patients usually will have some prior symptoms, some warnings, what you call warnings. Okay, heart attack, it is a complete stoppage of blood flow in one of the heart pipes. I
Right.
told 3 pipes will be there.
Right.
One of the pipe will be completely blocked. Then only there will be heart attack.
Right.
Okay, before the occurrence of complete blockage, there will be gradual progressive narrowing of the pipe. That is because of the cholesterol deposition. Whenever the pipe size decreases because of the blockage, once it reaches a critical range, that is 70% blockage or 80% blockage, then the person gets some symptoms, like while walking, particularly on steps, climbing steps or walking uphill, they will have a discomfort,
Okay.
breathing discomfort, and some people will experience pain in the chest while exertion.
Right. But isn't that discomfort common, Dr. Saab, कि हम जब सीढ़ियाँ चढ़ते हैं?
Yeah, breathing discomfort can be because of physical deconditioning.
Okay.
Those who don't have exercise capacity ज़्यादा अच्छा नहीं है,
Mhm.
डेली एक्सरसाइज नहीं करते ना, उनको अगर 1 floor 2 floors चढ़े तो बिकॉज आदत नहीं है ना, इसलिए दे मे गेट एक्सपीरियंस ब्रीथिंग डिस्कम्फर्ट.
Okay.
But if a person regularly was not experiencing breathing discomfort while doing some particular work, but if he starts experiencing breathing discomfort, which was earlier, it was his routine work, he was not experiencing earlier, but nowadays if he is experiencing breathing discomfort for the routine activities what he earlier used to do,
Okay.
so that is more indicative of something going wrong. He needs evaluation.
So it is something that was not predominantly there, but
Yes.
off late shuru hona.
ऑफ लेट शुरू होता है, yeah. Whether it is breathing discomfort or chest discomfort, giddiness,
Okay.
just feeling of weakness while walking,
Okay.
all these can be a symptom that indicates that you should undergo thorough checkup by cardiologist.
Right. So this was more to do with heart attack. लेकिन
Yes.
cardiac arrest के भी कुछ symptoms होते हैं डॉक्टर साहब?
So cardiac arrest is a sudden event only,
Sudden
but we can identify the people who are at high risk of cardiac arrest, like screening the heart by 2D echo.
2D echo.
Will identify any heart diseases like valvular disease, congenital disease, and cardiomyopathies. All these can be identified. So once they are identified, we can treat accordingly, whether medicine or surgery.
Okay.
Yeah.
डॉक्टर साहब ये भी देखने को मिला है कि आफ्टर कोविड-19 regardless of how fit your heart is, few people still complain that they can't breathe. The inhalation, एक deep inhale लेना मुश्किल होता है. For example, I suffer from that. Sometimes I feel that discomfort in taking a deep breath and exhaling it. But it does not mean that I have a heart issue. ये मैंने बहुत commonly सुना है लोगों को
Correct.
बोलते हुए.
Yeah.
So what is your take on that?
So the feeling a breathless in between without any heart issue can occur. Okay, I feel it is because of the proper exercise capacity is not that good. Another thing is, particularly during COVID, if anybody is affected severely, for example, we have seen a lot of people admitted and being on ventilator and recovered. They were having some limitation of the lung capacity.
Yes.
Their breathing discomfort is because of the limitation of the lung capacity, not because of the heart risk.
Okay.
So
that sort of debunks the myth के every
breathing discomfort is not heart related.
Not heart related.
Simple blood hemoglobin, if it is less, it is called anemia.
Anemia, yes.
So anemic patient also can have breathing discomfort.
Absolutely.
Every breathing discomfort person should not feel that they are having heart stroke.
Right.
At least if they are not comfortable as earlier, they should go for a checkup.
Absolutely.
Okay, so
Absolutely.
they cannot neglect that symptom.
I think that is what we are neglecting.
Yes,
कि हम इसको ना हाँ एक बार हो गया
They
चलो.
feel a common समझते हैं.
Absolutely.
People feel that it routinely maybe 2-3 दिन रेस्ट लिए तो कम होता बोल के सोचते हैं, लेकिन that may be an indication of near future heart attack.
Right. So you very rightly said that it sort of debunks the myth. और एक myth जो आपने शुरुआत में ही debunk कर दिया था, that is the correlation or I would rather say the alleged correlation that people were trying to draw between COVID-19 vaccine leading to sudden cardiac arrest. But recently AIIMS ने भी उसको debunk कर दिया that it's a myth. What is your take? आपका क्या कहना है इस बारे में?
I also strongly feel that COVID vaccination has no relation with the increased incidence of heart strokes. So during that time, there was a suspicion whether the COVID vaccine results in thrombus formation. That can occur in the early stages after vaccination. But after few years after this incidents occurred, so I think 2-3 years, everybody must have taken COVID vaccine 2-3 years back. Okay, so the effect of that vaccine will not persist more than 6 months.
Right.
So there is no direct relation with COVID vaccine to heart strokes or incidence of cardiac arrest.
Great. Dr. Saab, I think आपने बहुत अच्छी तरह समझाया कि what is the difference between heart attack and cardiac arrest. अब आता है सबसे अहम मुद्दा, that is how to save our heart. We know that CPR is the preliminary process which can actually save a dying heart, which gets into a cardiac arrest. But the question is, सबसे पहले तो सर डॉक्टर साहब आप हमको बताइए कि CPR क्या है और can it also save lives? What is the certainty? कितने percentage वो life को save कर सकता है?
Yeah, cardiopulmonary resuscitation (CPR). It is a very useful thing, particularly in cardiac arrest patients, and it is very useful if we make common responders. Usually, it can occur anytime.
Anytime,
so the
yes.
person traveling in a metro can develop heart attack, and those who was walking on the road can develop cardiac arrest. Okay. usual responders will be traffic police or nearby police person or any driver, anybody. If we educate them properly how to do a CPR, we may save some life. It can be anybody's. Okay, if some person collapses and if he's not responding, then the CPR may give us time to bring him to the hospital. Okay,
So what is the window?
Yeah, we should respond as early as possible, within 30 seconds to 1 to 2 minutes if a person collapse. Otherwise, if we delay is very much more than 2 minutes, then what happens? That means once heart is not functioning, there is no circulation to brain.
Absolutely.
There is no oxygen to brain. Brain will start get damaged.
Absolutely.
And it will be irreversible. Once the brain
Okay.
is, even if you resuscitate after 5 minutes, 10 minutes, heart will respond sometimes, but remaining organs will suffer irreversible damage. The brain will not recover. They will be on ventilator for few days, but they will not recover. So fast response for a cardiac arrest patient to do a CPR will save his life and other organs also. Okay?
But sometimes डॉक्टर साहब we may not get immediate help. 1 मिनट के अंदर शायद help ना मिले. Would you say that जो 8 मिनट का टाइम होता है after a
Yes.
heart goes into an arrest, is that 8 minute very very critical?
Yes, very critical. Every minute is important, but younger persons may give some more time for us.
Right.
But
Right.
elderly, usually, if it is more than 5 minutes gap, they won't recover.
They won't recover.
The children may recover even if there is a time gap because they have some reserves. So what is CPR exactly is giving a thumbs on the middle of the chest.
Right.
Okay.
Okay.
By using both hands, and even if you can take help of somebody, okay, by rotation you can do.
Because
Okay.
it is like
because it's a
100 to 120.
strenuous
Right.
work. No,
Right.
you cannot do CPR for 2-3 more than 2 minutes. You will get tired.
Correct.
Okay, na? Every 15 thumbs, you should give 2 breaths.
Okay.
Okay.
Two breaths. You mean mouth to mouth?
Mouth to mouth or whatever medium you can use.
Hmm.
So then you can save some lives. If you do that, sometimes heart will start contraction.
Oh, okay.
In some type of heart attacks, if you start CPR without any medication also, luckily, so the heart starts functioning and you will regain consciousness. So
Understood.
this can also occur in 10% to 20% of people.
Okay.
Some people may require medicines and all those things, persistent CPR. At least they can be shifted to the hospital if you give proper support on the roadside.
So that is for someone who's unconscious.
Yes, it's
And-
completely unconscious and cardiac arrest patients.
Right. So we should give the CPR only when the person has lost the consciousness
Yes,
because
correct,
of a cardiac
correct. We
arrest.
should not give CPR to those who are conscious and weak.
Okay.
If he is
Okay.
able to open eyes and if he is able to listen what you are selling, you should not do CPR. Okay?
Rather call for help and take them
help and
medical help.
make him shift to the nearest hospital as early as possible.
Okay. Okay. So what are the steps? What are the medical steps जिसको लिया जाना चाहिए right after resurrecting someone through CPR? उसके बाद immediately क्या करना चाहिए हमको डॉक्टर साहब?
Yeah, once the person comes out of, CPR response is there and the patient regains consciousness. Next thing is we identify what is his rhythm. That is, we will take an ECG
Okay.
that will identify the heart rhythm. Then we may screen the heart function also if we have the facility, 2D echo.
Mm-hmm.
Okay, we may screen the heart and we will see the saturation levels, oxygen, breathing is good or not. All this basic, we call it as ABC.
Okay.
So airway, breathing and circulation. So
Okay.
BP is good or not, breathing effort is there or not. All these things will take. in
Understood. And are there any preventive, किसी तरह का preventive medication दिया जाता है right after resurrection? और दिया
No,
जाता
no.
है तो कौन
Once
देता
once एक बार cardiac arrest हुआ तो he needs complete evaluation.
है? Evaluation.
Yeah.
Okay.
Once he survives from a cardiac arrest, he has to undergo thorough investigations. What has caused the cardiac arrest? Any preventive surgery or procedure to be done.
Okay. तो अगर किसी को resurrect किया जाता है after cardiac arrest and let's say after thorough examination हो जाता है, ऐसा आपने कितने % केसेस में देखा होगा कि there is an irreversible damage caused to the heart after a cardiac arrest?
Yeah, cardiac arrest can be because of a massive heart stroke,
Okay.
where entire muscle is almost not getting any oxygenation. In that scenario, its circulation problem is very severe.
Okay.
Whatever effort you keep, heart may respond little bit, but there is no backup from his circulation. So if it is irreversible problem in his circulation, then he may we may lose the patient over time. Okay, he may not recover completely. Only conditions where the heart function is good, but they developed cardiac arrest because of some other issues. Earlier, I discussed electrolyte imbalances,
Yes.
some temporary reasons.
Right.
Okay,
Right.
so all these can be completely recovered.
Okay. So you're saying they can recover. A person can fully recover from
fully
it.
recover and they may become fully functional also.
Oh. Okay. That's really
But
nice.
every cardiac arrest is not equal. If they
Right.
are having a severe heart weakness, sometimes they may take time. They may have future limitation of activities. But some people will have complete recovery after cardiac arrest recovery.
आई थिंक हमारे ऑडियंस को ये सुन के बहुत अच्छा लगेगा बिकॉज एक जनरल नोशन कॉमन पब्लिक में ये होती है कि इफ यू हैव अ सडन कार्डियक अरेस्ट इट विल short lead to death, and you have just debunked that myth also.
Yeah, only timely response. If he's lucky enough that somebody is there to respond,
right,
when a person gets cardiac arrest, if some nearby person immediately reacts and they know how to do CPR, and nearby hospital is there and proper care, sometimes they will recover fully functional.
Right. डॉक्टर साहब, अब बात करते हैं सम कॉल टू एक्शन के लिए फॉर ऑल आवर ऑडियंस. कुछ ऐसे सवाल मैं आपसे पूछूंगी जो शायद हमारे ऑडियंस को भी ऑडियंस के जहन में भी आता होगा अक्सर, दैट कैसे हम अपने हार्ट को इन जनरल, हाउ डू वी प्रोटेक्ट आवर हार्ट, हाउ डू वी प्रिवेंट इट?
Yeah. So to stay heart healthy, basic thing is you should be you should be tackling your stress properly. Okay, in our day-to-day life, we are exposed to so much work stress, and we have to tackle this stress. Particularly, stress is main important factor we have to deal. Otherwise, if we don't take care of ourselves,
right,
then we will develop stress-related heart issues.
Stress-related.
Yeah.
I think that's a very common occurrence.
Common. Yeah, there will be increased heart rate and they will have palpitation.
Right.
Okay, sometimes they may have increased risk of heart strokes.
Right.
Okay,
right.
and one stress base can lead to unhealthy dietary habits. Okay?
वो तो common हो चुका है आजकल.
So if then unhealthy life, food habits, if it is mixed with lack of physical activity, it is a bad combination. They may get all the risk factors which causes heart stroke, like diabetes. They are more likely hypertensives.
Okay.
They will have high cholesterol levels.
Okay.
So they will be at higher risk of heart strokes at younger age group.
Right.
Another thing I want to tell is family history of heart attacks. That means if a person in a family develops heart stroke below the age of 50-55, then his next generation
is likely to have it?
Yeah, in next generation, and his siblings, brothers and sisters, they should understand they are at a increased genetic risk for heart attacks. So they should be more careful. It is not that 100% they will develop heart strokes,
but there are chances.
They have to be more careful. They have to be visiting. They have to undergo health checkups frequently. They have to monitor their blood pressure, sugar, cholesterol more vigorously, and they should follow healthy lifestyle and all.
Okay, so with this, I have a leading question, Dr. Saab. You spoke about siblings. अब family में अगर parents को any one of the parent or both the parents have developed a heart condition, maybe not at a very young age, or in some cases we have seen people at 40 getting heart ailments. 40, 50, 60 तो generally होता ही है.
Yes.
Your heart starts to become weak. But in cases में भी क्या we should be on alert?
Yeah, we should be more cautious if the person develops below 55.
Below 55.
And
okay.
His family members and his siblings should be more careful.
Okay.
And if a person, for example, one of the parents who is 60, 70, they develop some heart stroke, it doesn't imply that it is a high family history or high risk of genetic risk.
Right.
Okay.
But if more people in the family of the same age group, let's say 60 के बाद, if we see that there is historically proven that family में एक trend है that people develop a heart.
That will suggest there is
it's-
an increased incidence
Okay.
in the family related issues.
Okay.
Genetic risk is little more, but we have to consider if a person develops younger age without risk factors.
Right.
That is a very
Right.
strong indicator for his next generation. Even if they have minimal symptoms, they should undergo thorough cardiac examination.
Absolutely.
Yeah.
Absolutely. डॉक्टर साहब एक बात बताइए, we have always associated sleep pattern with heart health.
Yes.
तो आज के लाइफ में आजकल का जो हमारा लाइफस्टाइल इज अ वेरी बिजी लाइफ एंड यू बीइंग अ डॉक्टर योरसेल्फ यू नो हाउ इट इज, राइट? हम लोग बहुत इजीली हासिल कर लेते हैं 13-14 घंटे के लिए, 16-17 घंटे के लिए एट वर्क, बट व्हेन इट कम्स टू आवर स्लीप पैटर्न और स्लीप फॉर लाइक गुड 7 to 8 hours, we are not able to bring in that balance. So what is your take? बहुत difficult है आज के जमाने में 7-8 घंटे की sleep.
Correct. To have a very good sleep, it is very much useful for being healthy at heart. Okay.
Right.
So sleep will reduce the stress in the body and inflammation in the body, and it needs for the recovery from the whatever the stress we are exposed in the earlier day. Okay. So proper sleep, at least 5 to 7 hours of sleep is required for a person to recover properly. Okay. So those who are having very less time, those who are very busy and not spending, not having proper sleep, they are definitely at increased risk of hypertension. Even though stress related issues like diabetes also can be more seen in them, and they can develop heart strokes in a younger age group. Okay.
Right. तो इसका और कोई रेमेडी है if someone is not able to make up, because we have seen that 13-14 घंटे हम तो काम करने के लिए निकाल लेते हैं, अपने लिए 1 घंटा भी नहीं निकाल पाते.
Correct.
तो कैसे, how do we, other than sleep,
Most
what can
of
we
the
do?
times, if we follow some physical activity of at least 45 minutes of a walk in a day, and not sleeping in the daytime, not
Okay.
having naps in between the daytime,
Okay.
and not watching, not having screen time, that is watching phone or TV just before sleep. So all this will stimulate your brain and you will not get proper sleep.
Right.
So avoiding screen time just before sleep, and having good hydration throughout the day. So all this will help in having a proper sleep. Okay.
Absolutely.
Even if it is not disturbed sleep. Okay. Particularly those who are very obese, they will have a condition called sleep apnea.
Sleep apnea,
Sleep
yes.
apnea. Their breathing pattern, sometimes it will stop
Automatically.
during, and again reset. That will disturb this sleep. Deep sleep will not be there. So they will have a very unhealthy sleep during night, and they will start getting sleep while sitting in the daytime. Okay, they are a very high risk of hypertension, heart issues.
So जिसको sleep apnea है उसको क्या करना चाहिए to prevent their heart?
Yeah, first thing we have to confirm it whether their sleep apnea is there or not. We can do a test called nocturnal sleep study. That is, they will assess how much is your breathing, how frequently your breathing is stopping in between apnea episodes.
Okay.
And based on that, if they are very severe, they will there is a treatment called pressure vent mask.
Okay.
They can keep that pressure mask. They will have a better sleep in the night. Over time, it will come down.
Okay. But it can be prevented.
It can be prevented and treated also.
If it is detected at an early stage.
Yes.
Okay. डॉक्टर साहब, और एक सवाल है, and I think बहुत सारे हमारे audience जो कि those who have an addiction or an inclination towards smoking and drinking,
yes.
उनको शायद ये फायदेमंद लगे या फिर उनको शायद पसंद आए, but we'll still talk about it, Dr. Saab. How much of impact does it have on your heart health?
Yeah, definitely smoking is very risky for a heart health, because the person who smokes, they will be at increased risk of heart strokes, because the blood which flows in the blood vessels itself can get clot.
Okay.
The smoke can cause the blood to clot. The clot itself obstructs the blood circulation.
Okay.
So there need not be any blockage. There need not be any cholesterol deposition. His pipes must be normal in angiogram, but the circulating blood itself can clot.
Okay.
So that's why we can see a very young population getting heart attacks because of smoking. They will have healthy pipes only. If you do angiogram, the circulation will be good only earlier. Okay?
Right.
Once when while they are smoking, they are always at risk of blood clot formation.
Absolutely.
Okay, if some people who are lucky enough that they didn't experience heart stroke because of smoking, over time there will be cholesterol deposition. They will develop blockages over time.
Okay.
The person who smokes longer period, they are at risk of multiple blocks. Okay, so they will have heart strokes in future.
So
Okay?
you're saying
The
that
best thing is to stop smoking.
stop smoking.
Okay, because it's very risky, unpredictable. And
Yeah.
if a younger person develops heart stroke, they don't have any reserves.
Right.
They
Absolutely.
will almost collapse.
Absolutely.
Okay, so elderly, they may have some collaterals. They will give some time for the treatment. But younger population like 20s, 30s, if they develop heart stroke, most of the times there will be cardiac arrest and death.
That's very unfortunate.
Yes, very
That's
unfortunate.
very unfortunate. That brings us to the last question of our podcast today. We use a lot of gadgets, Dr. Saab. जैसे मैंने अभी हाथ में एक घड़ी पहन रखी है. I see you're not wearing it.
Yes, yes.
But yeah, we wear a lot of these स्मार्ट वॉचेस एंड ऑक्सीमीटर तो पैंडेमिक के बाद आई थिंक घर घर में आपको ऑक्सीमीटर मिल जाएगा. हाउ मच कैन वी रिलाई ऑन दीज गैजेट्स?
So they will be helpful in some situations, but usually, particularly when a person is going exercise training and all those things, they can have a check on their heart rate.
Right.
Too vigorous exercises, sometimes heart rate is too high. They may be harmful also.
So what is too high, doctor? When should we be careful? कितना 100 के ऊपर चला गया, कितना होना चाहिए?
Usually it is related to the age.
Age also. Okay.
So roughly if you take a 40-year-old, his maximum heart rate is 220 minus 40.
Okay.
So that is almost 180.
180.
But we should target whenever doing exercises. So 65 to 75% of this target.
उससे ज्यादा नहीं जाना चाहिए.
ज्यादा नहीं जाना. 180 में 70% we should keep a target, and our heart rate should be something around that 10 beats इधर उधर.
अच्छा.
Okay, so otherwise if it goes above 180,
it's a risk.
Your heart will be at more stress, and
right.
They may develop some complications also.
So again, can we tie this back to the strenuous gym activities also?
Yes.
जहाँ पे लोग collapse होते दिख रहे हैं हमको.
Those even the well-trained persons also during this very vigorous activities, they may develop some heart rhythm related problems.
Okay. Okay. So Dr. Saab, before we इस पॉडकास्ट को खत्म करने से पहले your advice for our audience at Coffee Commerce और कहानियाँ.
Yeah. First thing, we should be aware which people develop heart attacks. Okay, particularly elderly, hypertensive, diabetic, smokers, those who are having high cholesterol. They should be more cautious. Whenever they develop any warning sign or symptom, they should get a proper evaluation and screening for heart related issues. Okay, and another thing is to reduce the stress. We have to do daily physical activity, and we have to follow almost every time we should be conscious about the food what we consume. We should be taking only healthy food, avoiding junk food, particularly oily fry items and outside street foods.
Right.
We should avoid, and we to undergo frequent health checkups. That is every yearly once in 2 years, you should undergo your routine blood profiles and basic heart checkups. They will help in detecting some silent problems. Okay.
But this is for people who do not have any issues.
There is no heart issue earlier. This is called primary prevention.
Right.
Before developing any problem, we should be cautious.
Right.
From the age of 20 years onwards, we should be more cautious about.
So once you, so that is from 20 to 30. After 30, 35, you generally are transitioning towards your mid-age.
Correct.
तो इस फेज पे हमें कितने बार चेकअप करना चाहिए अपना? थरो चेकअप.
thorough checkup means even otherwise asymptomatic, no symptoms,
No
and
symptoms.
healthy person, at least every 1 to 2 years we have to
1 to 2
concentrate.
years.
After 40 years, every year.
Every year.
Yeah.
Okay. Okay. डॉक्टर साहब बहुत बहुत शुक्रिया आपका फॉर शेयरिंग ऑल योर नॉलेज with so many cases rising in India these days. I think ये काफ़ी सारे सवाल थे, हमारे ऑडियंस से भी काफ़ी सवाल आए थे. There was a special request from one of our audience, from one of our subscribers indeed,
Okay.
जिन्होंने ये रिक्वेस्ट किया था कि if we can get a specialist, an actual subject matter expert who can explain the issues more better. और उसके लिए ही हमने ये पॉडकास्ट आपके साथ रखा. आप डॉक्टर साहब आपका बहुत बहुत शुक्रिया कॉफी कॉमर्स और कहानियाँ को अपना महत्वपूर्ण और अपना वैल्यूएबल समय देने के लिए. There were a lot of questions from our audience and I hope our special podcast with Dr. C. Santosh Kumar has answered all your questions. And to watch more such episodes, please subscribe to Coffee, Commerce और कहानियाँ. आप सबका महत्वपूर्ण और वैल्यूएबल समय इस चैनल को देने के लिए आपका बहुत बहुत शुक्रिया.